Tonight, we turn our focus to the racial disparities affecting women of color during childbirth.
Eyewitness News reporter Micah Thomas has more on what many are calling a public health crisis and what mothers here in Kern County need to know. Micah?
That's right, Michael Rochelle. Organizations and advocates across the country have been speaking out and taking action this week to close the gap in adequate care for Black mothers and other minority groups. And I spoke with a few local advocates who have been leaders for this cause in Kern County.
Black women are human. We feel pain. We deserve adequacy.
Black Maternal Health Week is annually observed April 11th through the 17th. This year, a study by the California Equity in Maternal Health explored the maternal health experiences of Black and Latino women across California. On Thursday, the Black Women Organized for Political Action and the Hispanas Organized for Political Equity held a joint conference to present key findings from the report, which included more than 50% of women surveyed reported experiencing unfair or adverse treatment during pregnancy or birth.
Today's briefing is not just about the data. It's about the lives, voices, and leadership of women committed to dismantling disparities in maternal health care.
Statistics published by the CDC report that the maternal mortality rate for Black women was around 50 deaths per 100,000 live births in 2023. Kern County has one of the highest maternal mortality rates in the state, but local advocates are stepping up to change the narrative and experience for Black mothers.
9 times out of 10, when I'm hired as a doula by a Black woman, the first thing she says to me is, "Danny, please don't let me die."
Wallace shared that her work has been inspired by her own experiences.
I was in labor. I'm passing bones through a very small area and being told it doesn't hurt that bad. It does hurt.
Trinity Brown is the founder and CEO of the Noel Alexandria Foundation, a Kern County-based nonprofit dedicated to supporting and educating families that have experienced pregnancy and infant loss. Brown says that both advocacy and education are major for the foundation.
A mom that has experienced loss or multiple losses, letting their doctors know up front so that they are marked as high risk and that their questions and concerns that they have are really taken into consideration and that they're really being heard. We have 90% of our families have gone on to have healthy pregnancies, both mom and baby.
Back in February, the Department of Health Care Services rolled out an initiative aimed at improving and transforming maternity care in California. In studio, Micah Thomas, Eyewitness News.
Hi, I'm Rochelle Murcia with Eyewitness News Bakersfield Now on YouTube. Thank you for checking out our YouTube channel where we have tons of great content to choose from. While you're here, go ahead and click on the subscribe button right there. That way you can stay up to date on all the things related within Kern County. Thanks for watching.